Hello, dear friends. Today's conversation will be about reducing the risks of type 2 diabetes, osteoporosis, migraines, hypertension, and heart disease. It will be about magnesium in food, water, and supplements. Magnesium is an element that is widely distributed in the human body. It is essential for more than 300 enzyme systems that regulate various biochemical reactions in the body, including protein synthesis, muscle and nervous system function, control of blood glucose levels, and blood pressure regulation in blood vessels. Magnesium is essential for cellular energy production, RNA and DNA synthesis, and bone formation. Magnesium is involved in the transport of potassium and calcium across the cell membrane and thus affects the conduction of impulses along nerves, muscle contractions, and heart rhythms. The human body contains about 25 grams of magnesium, distributed equally between bones and soft tissues. About 1% of magnesium is found in the blood. Magnesium concentration in the blood is stable and varies between 0.75 and 0.95 millimoles per liter. Excess magnesium is excreted in the urine. The human requirement for magnesium is about 420 milligrams per day for men and 320 milligrams for women. Here are some data on the magnesium content of foods. A lot of magnesium is contained in buckwheat, 231 milligrams in 100 grams of dry ingredients. Also spinach. Half a cup of cooked spinach contains 78 milligrams of magnesium. 28 grams of roasted almonds contain 80 milligrams of magnesium. 1 cup of diced avocado contains 44 milligrams of magnesium, and a bag of instant oatmeal contains 36 milligrams of magnesium. Basically, all plant foods rich in fiber are high in magnesium. Magnesium can also be found in mineral water, with some varieties containing up to 120 milligrams of magnesium per liter. Despite this, the nature of modern nutrition is such that most people don't get the right amount of magnesium. I've compiled a rough list of foods to consume daily to cover your magnesium needs. Let's take 420 milligrams of magnesium as the norm. You can meet this requirement by eating 600 grams of buckwheat oatmeal, totaling 461 milligrams of magnesium. If you diversify the menu, the daily ration to meet the need for magnesium will be about 300 grams of buckwheat oatmeal, half a cup of boiled spinach, half a cup of cooked beans, and 28 grams of roasted almonds. In total, this is 418 milligrams of magnesium. Studies show that not all people can sustain such a diet daily. As a consequence, most have a deficiency in magnesium intake. The situation is aggravated if there are problems with absorption of food in the gastrointestinal tract, alcohol abuse, or diabetes mellitus. The symptoms of magnesium deficiency are nonspecific. Early signs of magnesium deficiency include loss of appetite, nausea and vomiting, fatigue, and weakness. As magnesium deficiency worsens, numbness, tingling, muscle cramps, personality changes, heart rhythm disturbances, and coronary artery spasms may occur. Chronic magnesium deficiency may increase the risk of cardiovascular disease, hypertension, diabetes mellitus, migraine, and osteoporosis. Many studies have been conducted on the effects of magnesium on blood pressure and atherosclerotic vascular lesions. The current findings are that raising blood magnesium concentrations to the upper limit of normal reduced the likelihood of sudden cardiac death by 38%. The effect of magnesium supplementation on blood pressure is small and decreases systolic pressure by 3 to 4 millimeters of mercury column and diastolic pressure by 2 to 3 millimeters of mercury column. Regarding the effect of magnesium on type 2 diabetes, a diet high in magnesium significantly reduces the risk of developing diabetes. It is due to magnesium's influence on glucose metabolism. Low magnesium content leads to the development of insulin resistance. Interestingly, in diabetes, the kidneys excrete large amounts of magnesium, and a magnesium deficiency occurs, leading to even more impaired glucose metabolism. Numerous studies have shown that increasing magnesium intake reduces the risk of developing type 2 diabetes by 15 to 23%. At the same time, magnesium supplementation for existing type 2 diabetes does not affect the course of the disease. Regarding osteoporosis, magnesium is involved in bone formation and affects the activity of osteoblasts and osteoclasts. Magnesium also affects the concentration of both parathyroid hormone and the active form of vitamin D, both primary regulators of bone homeostasis. Several studies have shown that increasing magnesium intake from food or supplements leads to increased bone density and prevention of osteoporosis. Magnesium is involved in the regulation of vascular tone and nerve impulse transmission. People who suffer from migraines are thought to have low blood magnesium levels. Some studies have shown that taking 600 milligrams of magnesium daily can reduce the intensity and frequency of migraine attacks. This dose is usually divided into 2 doses. Since magnesium intake exceeds the daily norm, such treatment is carried out only under the supervision of a doctor. The American Academy of Neurology guidelines state that magnesium therapy is probably effective in preventing migraines. Excessive magnesium intake in a healthy person is practically safe. Excess amounts are usually excreted in the urine. If too much magnesium is consumed, diarrhea develops. Toxic effects are possible with an intake of more than 5 grams daily. The upper tolerated dose of magnesium supplementation is 350 milligrams per day. It is considered that some amount of magnesium a person receives with food and water anyway. Since magnesium deficiency can lead to many of the above health problems, you have to make a choice. It is possible to calculate the diet in such a way as to get the right amount of magnesium from food. It's easy to do so. Many tables are available on the internet showing how much magnesium is in a particular food. If you realize this is impossible for you, you should take supplements. Small studies have shown that magnesium in aspartate, citrate, lactate, and chloride is absorbed more completely and bioavailable than magnesium oxide and magnesium sulfate. Thank you so much for your attention. Always for you, Dr. PopMed.